Hello there, my name's Doug Gillanders. I'm one of the partners in EastMed Doctors in St Helens in Auckland. We're a group of about 10 docs, and we moved to the text to remind ability probably about 4 months ago. The driver for this was to try and unload a lot of the phone calls from our nurses and to try and speed up the reply of results, interaction with our patients. We all know the issue when you ring, nobody there, you leave a message. We trialled it with a few patients to get their response, and I'd have to say, we didn't canvass them all, but those that we did speak to were universally in favour of it. We found it hugely useful. I have to say the nurses are probably the biggest users of this, almost to the point where we've said to them, hey, hang on, let's really target the useful stuff on here rather than almost tweeting stuff. But the ability for all of us docs particularly, I mean, we all know the issue, you get your lab results in, like to get a response to the patient, 2 quick keystrokes, outbox, short message. We tend to, and we say to our patients, A, we get their approval that they'd like to be contacted this way, and B, short message. When I say anonymous, it's got EastMed in the title line, but it's basically not too much detail. Hey, a blood test looking good, see you 3 months, or things along those lines. Has been useful for contacting people about INRs, again, when you can't always get in touch with them. The nurses, of course, use it a lot. What we're trying to do is actually unload the nurses, because we can do quite a bit of that. I know you want to move things on to nurses. We can do quite a lot of that. As I said, 2 quick keystrokes and it's done. It's not a question of leaving a message for the nurse, can you please let someone else know. We were pretty cautious the first time and ordered the smallest bundle available. I think we've far exceeded that and probably jumped up 2 or 3-fold since then. As I say, patients are very appreciative. It has told us that we've got to really make sure updating our cell phone numbers, because some of those are pretty historic. It's a bit embarrassing you get the text not received bounce back. But we're very pleased. And I think if you spoke to any of our nurses, they'd be hugely pleased. We didn't have it for the last flu vac. A lot of those groups are the older patients, so a lot of them have cell phones. I mustn't be judgmental there. But yes, we see those having a huge application instead of sending out letters. And 2012 is going to be the trial of that. Certainly useful for child immunisation reminders. I have to say, on the fast part, recalls, patients are pretty good. They know when they need to come in, but those that you have, it's a 2 or 3 year recall, mammograms, smears particularly, it's been useful for that. And it's also been useful, I just saw a patient today where we've been trying to get hold of her about some of her blood tests, and she was here today in response to my text complaining that a text went off on the golf course, and I said, well, it shouldn't be on the golf course, but that's another matter, saying blood sugar's up, time we met. Here she is. Now that's saved a phone call, and it's been fantastic. But yes, you're right, the flu thing is going to be a real test, which we feel positive about. We have a good response rate, be it by letters or telephone calls. So this is just another medium which is quicker. So I can't say whether it's more efficient or effective from patient response, but I think it's an awful lot more efficient from going out to see. That's the main thing. Overall, we have very good response for when we send out letters and phone calls. So it's more that this is a more efficient mechanism. It's instant and it's done. And there's a log. I know I was going to talk about before. There is a tendency for patients to respond to lots of these things. We're trying to say to them, hey, this is, I'd be interested to know what other people do, but we predominantly want to do it on an outgoing rather than having prolonged text conversations going on. But we do, because of the responses, we've put in place a daily look at the log that's coming in. But we see it more as a communicate outwards, and I'm not sure that's the prime focus the company was looking at. Yeah,
absolutely.
The coming in is an issue which we hadn't properly taken on board, but I'd be interested to see what other people think about that. But no, I think it's been universally positive. It behoves us to tidy up our cell phone contacts.
Yeah.
And the issue of having a little marker saying, or I tend to put in the notes, patient happy.